Welcome back. A 42-year-old Swiss tourist is now in isolation at a Limpopo health facility after testing positive for monkeypox. The European's become the third person to be diagnosed with what was a rare viral disease in South Africa. Dr. Phophi Ramathuba is the health MEC in Limpopo. MEC, good afternoon to you. How was this case of monkeypox found?
Afternoon, Stephen, and afternoon to all your viewers, and thank you for inviting us. What we can indicate as the department is that on the 2nd of July, immediately after arrival, our patients started experiencing some of the signs and symptoms of monkeypox. For instance, he had fatigue, he had rash, and also a lymphadenopathy, and he then immediately consulted a physician who then took a specimen. And yesterday, unfortunately, the bad news for us, the NICD communicated with us to say he has tested positive.
So where is this person now? They're being kept in a government health facility?
Immediately when you start to show the signs, we always advise that you remain in isolation while we're waiting for the results, because especially when you've got those rashes which are blister-like, we worried that you could be continuously spreading because you stop being infectious when the rash has resolved. So we immediately advise on isolation while waiting for the results. When the results come, you continue with your isolation, but that's when the work of contact tracing begins. I must also share with the public that with the monkeypox virus, our contact tracing, we categorize into 4, where we look at if there was face-to-face contact where you would not be necessarily wearing a mask. We also look at the issue of if you had been in contact with the skin of a person who has developed those rash, because they become highly infectious to you. We also look, because this is a lodge or a hotel facility, we look at the staff that is working there, if they were wearing their gloves in case when they are handling the linen, because the linen might have been infected, and because the lesions can be all over the body. And lastly, we also look at your sexual contact. So in this case, we've been able to pick up 3 to be contacts, and what we're going to be doing and what we've started is for the next 21 days, we'll be closely monitoring these 3 contacts. If any of them can develop any symptoms or signs, we will therefore collect specimen and take for the laboratory to be tested. But as it is for now, the treatment, because this is a mild form of the disease, doesn't warrant hospitalization. Isolation is important. What we do is that we will not necessarily dictate where the person is being isolated. What we always do, we are in close contact with the lodge management, and we are satisfied in terms of them, because what comforted me was the reports that we have is that all the staff in that lodge, like many other lodges, they are still very religiously wearing their mask when they are serving their customers. Even those that are cleaning our rooms in our province, we still continue to encourage them to be able to wear their gloves, because they will never know. Diseases is not just monkeypox and COVID-19, but COVID-19 has taught us, let's go back to the basic hygiene principles, because those are the issues that can make us to reduce the burden of disease as a result of infectious disease. So for us, it's prevention, and and early detection, when you see signs, contact us, and isolation. And the also good thing here is that monkeypox, when we say to people remain calm, it's because we know what causes monkeypox. We have got the vaccine for monkeypox. We are also saying we know how to protect ourselves, and we also know how to reduce the complications, and it's not as deadly as the COVID-19.
So you're saying you're not worried, you don't sound too worried about it at this stage?
Stephen, we have dealt with the West, which was COVID-19. Hence, we are saying to the people of Limpopo, our life must continue as long as we follow basic principles in terms of public health, how to protect ourselves. If we continue with our hygiene, washing of our hands with water and soap, These days we've been taught about sanitizers where we do not have water. And so when we're encouraging those who used to donate sanitizers to schools where we don't have water to say, please continue, don't stop because you are told that we are no longer dealing with the waves of COVID-19. The reality is that there are many other infectious diseases which are out there. So the basic hygiene does not necessarily deal with COVID-19. So for us, we're saying we're not really worried because we understand how monkeypox transmits from one individual to another. And the fact that it has been there, Stephen, it has been there, especially in our continent. There were many countries in the continent where these cases were detected. It's just that currently we are starting to see it in other continents where it has never been. In the European countries now, when you see cases in Canada, in the US, it's something that it never happened previously. And for many other reasons that we see all these re-emergence of diseases in the other parts of the country or the world where they were never there before. So for me, we shouldn't be too scared as we are, because the problem, if we get to be in the panic mode and get worried and scared, we will therefore lose focus. So let's really focus on the basics. And if we do that, I'm telling you, we'll be able to cap this virus, and it will not spread, and it will not be causing